Psychiatric examination. The presentation of any illness is affected by the way the patient reacts to his illness, and the state of mind can also affect the physical illness. As a short psychiatric examination is necessary in all cases, even though psychiatric examination is essentially history taking. A general physical examination should be done in addition in order to discover any organic cause for the psychiatric presentation. In practice, a series of interviews may be needed to understand both the genesis and the cause of the psychiatric illness. In addition, a history from a third person must be necessary to come to a diagnosis. So, in the first interview, an overall history and prominent abnormalities of the mental states would be detected, as well as the patient's personality is assessed. In a psychiatric case, the initial interview with an experienced practitioner may take half an hour, and subsequent interviews are briefer. It is advisable that the patient and the clinician sit at right angles to each other in order to avoid phased stares. But throughout the interview, the clinician must be observing the patient's demeanor and the way one answers questions. Question and answer technique is not appropriate. After taking particulars of the patient, it is advisable to start with neutral questions like your occupation, marital status, and religion. And this gives the patient time to settle down. And then find out the reason for referral. Did the patient come by himself? Was he accompanied by relatives or the police? Or the police brought him for examination? The clinician must have time to expand the complaints. And sometimes the presenting complaint may only be a forefront of for the real complaints worrying the patient. So after gaining the patient's confidence, a person who initially complained of intractable urethral pains unresponsive to any medication has actually come because of importance because of impotence rather. So the present illness, family history, and personal history are then explored, and previous illness and personalities also explored.